Wear a mask. Don't wear a mask. Wear a mask for this period of time. Wear a mask if you're indoors. Wear a mask if you're outdoors. You've been through this now for what seems like forever. The messaging from the Centers for Disease Control has been perhaps among the most egregious of their efforts in fighting the COVID pandemic. Paul Seegert joins us. He is the managing partner of PCS Advisors, a financial planning firm, and also a healthcare consultant. There are some thoughts about these confusing and conflicting CDC recommendations. I understand that we have not had a handle on this from the beginning, Mr. Seegert. Is this just a case of the government groping but doing the best that it can, and sometimes evidence points in one direction and sometimes it points in another, or am I making excuses and rationales for them?
Well, I think if we were to go with Dr. Fauci's own description of some of how his positions have evolved, he called it, I believe, noble lying, where they've told the population, those that are leading us through this, our response, have told the population some things that sometimes to influence behavior in a certain way. I think the mask example that you used leading into this is a prime example of that. We were told we don't need the masks, but it was really because they didn't want to run on masks and PPE in general that was needed for healthcare workers. And throughout the whole experience, I took notes on a couple of pages, just put down all the things that have changed and evolved before our time together.
Yeah, take the time necessary to go through that, because for most of us it's just become a blur, but it is worthwhile reviewing. So just take what time you need to go through all of the this and all of the that and the back and the forth.
Well, you've got herd immunity. When that was our goal. At first, we were going to slow the spread. We weren't going to stop COVID. I think the science, most folks didn't believe that was really possible. We were going to slow the spread so that we could build capacity in our system, in our hospital system, to handle surges of hospitalizations and ICU beds, increase ICU beds and that kind of thing. We actually haven't really done that, but that was the initial messaging. And then we started to talk about herd immunity, and we even set up some field hospitals that nobody ever was put in a bed in Washington State, and then there was the ship that was parked outside of New York, and so on. But we had that. Then we started to talk about herd immunity and what that was going to require, what percentage of our population was going to have to get vaccinated for us to achieve herd immunity. And we started out at 70%, and then we went to 80%, 90%, and then the goal kind of just became 100%. And I don't know so much if that was evolving science and understanding of science as, again, some of that noble lying, where the thought was that if this bar was set too high, it would seem unattainable, and maybe they wouldn't sell it. Then, is COVID dangerous, or is it not? How many masks do you need to wear? We started at 0, then we went to 1, 2, 3. Face shield is good. And now you have experts, as we seem to be getting, hopefully, toward the tail end of this pandemic, we've got experts that will be on mainstream media outlets acknowledging that many of the masks that people have been wearing maybe haven't been useful. So we've kind of come full circle on that. Is it natural, or is it from a lab? If you said it was from a lab leak, that was a conspiracy theory at one point, and now it's considered a real possibility. Is it airborne? Yes or no? Can it be transmitted on surfaces? Are schools safe? Can you open schools without the teachers being vaccinated? That was a yes, but through some influence of the teacher unions and other things, that became a no. And now it's a yes again, because I think people are tired and worn out, and there's now enough evidence that has had a major impact on kids, and not a positive one, that it's become a yes again. Although, that's a whole other topic. The unions still shut down the schools in Chicago. We're watching that happen right now. A real recent one, we changed our quarantine period from 10 days to 5. And then the thought was, do you need to take a test at the end of that? And the answer was no. But then with all the changes and the evolution of the guidance that we'll be getting, there's been a lot of rational questioning around that. How can we go from 10 to 5 and not test people at the end of that 5-day period? And in fact, the American Medical Association came out last Wednesday and disagreed with that. That's another issue that we face, is you have really long-standing credible institutions that are not coordinated in the messaging at all, and oftentimes giving opposite messaging.
Wow, I can't even keep score.
I'm about a third of the way through it.
No, please, we'll continue. No, I'm sorry. Please continue. This is important because, well, it is for obvious reasons. So please continue.
Well, and you just looking at that quarantine reduction with or without testing, and looking at some of the comments from our own CDC director, when she was asked about that, she said, no, we're not using rapid tests because at the end of this quarantine period, we're not recommending rapid tests because the FDA doesn't recommend that. When in fact, if you go back and look at papers that she co-authored, not that far back, 2020, she authored a paper where she said they were ideal for this very purpose. And it's not difficult for Americans to find this kind of stuff. We all have this amazingly powerful smartphone in our hands, and you can see those kind of contradictions. That doesn't build confidence. And other peer countries of ours have reduced their quarantine period, but have implemented the use of these fast-acting antigen tests or at-home tests. But so then that leads to questioning, are we getting this advice because we really don't need to do the test at the end of the 5 days? Or are we getting that, are they taking that position because we actually don't have tests? Somehow we're way in the back of the pack on testing capability, which should definitely not be the case. We're the folks that did Operation Warp Speed and brought these vaccines to market in record time. How is it possible that we didn't apply that same sense of urgency to testing, and we didn't? I mean, that could be its own whole segment or show. So that's part of it. Here's some more. It's okay for nurses, if you don't get vaccinated and you work in a healthcare setting, you get fired. Now they're facing such a staffing shortage. 1 in 4 hospitals reports a critical staffing shortage currently. And so as a result, we're saying it's okay for nurses who are vaccinated but COVID positive to work and treat patients. California just announced that within the last few days. Others have also done that, other states. But if you're unvaccinated and COVID negative, you're not able to work at those facilities. A person that could make people scratch their heads or lose confidence. Another one would be, are we all at the same risk for COVID? Now if you really were following the science through this experience, you've known pretty much the whole time, even with the earliest reporting out of Italy, that there were higher risk groups than others. Comorbidities, obesity being one of the biggest. And now we're getting, that information is getting shared publicly. I think the CDC director herself stated here within the last week that when they look at recent COVID deaths, 78% of them had 4 or more comorbidities. And we're starting to hear that the numbers that have been reported about deaths related to COVID include people who died of other causes, but also tested positive for COVID. Same thing with hospitalizations. I think New York State within the last week started to report that, parse those numbers out of the hospitalizations, COVID hospitalizations that we have, how many of them are hospitalized because of COVID versus having it incidentally. And it's about 50-50. So a significant difference in the way that you might interpret those numbers. Same thing with percentage increases in childhood hospitalizations. Those are often being reported without real numbers. When you have 2 goes to 4, that's a very big percentage increase, but maybe not a big increase in terms of real numbers. And again, you have that same issue. Is it incidental hospitalization, or is it because of COVID? And now they're Dr. Fauci within the last week was on mainstream media outlets starting to separate those numbers out. Is natural immunity as good as vaccination? We've taken a very narrow approach, or a single approach. I think it's part of the reason that we're behind so significantly in testing, is that we put all of our chips on getting everyone vaccinated. And if we would do that, we would stop the virus. And we, in the process, downplayed or even made natural immunity seem as though it were a conspiracy theory or some sort of anti-vaxxer thing. But there's now more than 90 studies that confirm that that is a real thing, and it is strong. In many cases, it can be as strong or more durable or more long-lasting, but certainly can be as good as the immunity that folks get from vaccination. And there's 6 studies that say if you have natural immunity and you get vaccinated, you have a higher likelihood of an adverse reaction. We didn't want to talk about those things because we don't want to discourage vaccination. So there's this common theme, I think, through all these things where we have messaged to influence behavior, but we haven't always messaged just plainly and honestly with the facts that we had at the time. And it's led to a state of affairs today where you have scientists and public health experts that don't agree with the way we're handling certain parts of this, and yet they're afraid to speak up and talk about it. There's a great interview that you can find with Dr. Harvey Risch from Yale, who does some great commenting on all of this and points out that, and he and some others have had the willingness to go out and question who's driving this ship, who's in charge of our response. Is it Big Pharma, or do we really have leadership that's cohesive, that's handling our response? And when you go through this list of things, and then you just we could talk quite a bit more about just the testing in and of itself and how we're so far behind the rest of the world in testing. It's not an illogical conclusion to say we're lacking some coherent messaging and some leadership in this area.
Now then, we do have breaks we need to go to, so I want you to finish your list when we come back after these messages. Welcome back to the Jim Bohannon Show as we talk with Paul Seegert, healthcare consultant, managing partner with PCS Advisors. We're looking at all of the confusing, conflicting, and contradictory recommendations that have been made regarding this pandemic. And we're not done. So please go ahead, Paul.
Well, we're getting close, and then I think we have quite a topic just talking about the testing mess that we have on our hands in terms of the shortage of testing. But another thing that came to mind was the fact that we are in this mess and we don't have tests. And yet we have companies, American-based manufacturing firms that have tests that are approved by our peer countries that are shipping tests to Europe that people can buy in their drugstore at $3.50. And they have no shortage of supply, and we don't have them available.
We're shipping these out of the country?
Yes.
we have a gross shortage here, and we're shipping them elsewhere? Well, how generous we must feel. Please continue.
So that, to me, is just wildly alarming and deserves some more conversation for sure. And you have from the president down, the president, the CDC director, and others that we all see commonly talking about this topic on the news outlets, saying that they wish they'd ordered 500 million tests here at the end of the year in preparation for this current surge, this Omicron variant. And
we might start by telling Europe they can wait their turn.
Well, exactly. And it's our own fault when we get there. The FDA.
Yeah, forgive me for being an American chauvinist pig, but please continue.
So we've got that. They're on the one hand telling the public we wished we had foreseen this and we could have ordered tests. But when you track back through what we've actually done, in October, there was a proposal made to the administration to purchase for release 730 million at-home tests a month that would be put into our marketplace, and they declined to do it. Again, going back to this one direction of vaccinate, 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 and I'm not an anti-vaxxer, but I would also like to have tests right now for our population, and it would have been great had we had them early on in the pandemic. As soon as they put the sequence up on the internet, Germany had a test made within a week, and the WHO used their test and sent 250,000 of them out around the world, so there would be some tests out in the world, and we took months to get going in the same way, and it goes back to, that does go back to...
What, did we go from Operation Warp Speed to Operation Tortoise Speed? I don't understand.
Exactly. Absolutely we did. In fact, there was a scientist in the state of Washington that submitted, he was right there with the Germans, right as soon as it was released. He was working on a test, and he submitted his application to the FDA by email, and they responded that they needed one sent in the snail mail. He then sent the one in the snail mail, and they responded that they also needed a copy on a compact disc, FedExed or delivered to their headquarters. And so after months of red tape, and frankly, other entrepreneurial organizations fell by the wayside, he stuck with it. After months of red tape, it got approved, but by then, Washington was already on fire with COVID. And we've got companies, California-based biotech companies that did a peer-reviewed trial, built a test, submitted the results to the FDA, only to get a response months later that they had some additional email information they needed. They responded within 2 days. More months pass, and eventually they're told they're going to get deprioritized, moved to the back of the line, and they give up. And they spent millions of dollars developing this to respond to a need, a real need that we had. So when you see these kinds of things, I think it's understandable why there's you can equate that with a lack of confidence. And so now, what are we going to do? We've got.
Well, are we close to the end of the list? I'm just trying to figure out with the calls stacking up to talk to you.
We are. The rest of it is just going to be going into detail on where are we with the testing, why are we there, how can we fix it. But
all right. Well, we will talk about all of that and continue our discussion. Again, if you're on hold, we're going to get to your calls right after the forthcoming break at 1-866-50-JIMBO, 1-866-505-4626. The messaging of all of this has been absolutely infantile. It's just remarkable. And Paul Seegert, healthcare consultant, managing partner of PCS Advisors, actually took the time to figure out all of the various instances of confusing, conflicting, and contradictory recommendations. And it took us till now just to get them out there. So your call's coming up, 1-866-50-JIMBO, 1-866-505-4626, on a situation that could have been better, I think, pretty clearly. Stand by, more to come. Back in a moment. Welcome back to the Jim Bohannon Show at 1-866-50-JIMBO, 1-866-505-4626. Paul Seegert, our guest, a healthcare consultant, managing partner of PCS Advisors, and the comprehensive list of all the contradictory, conflicting, and confusing things that the Centers for Disease Control has had to say these past several years. Here's a call from Alan in Champaign, Illinois. Good evening.
Hello.
Hi.
I hardly know where to begin with this, but it's my thoughts that all of this is deliberate, and all you need to look at is that the government is withholding the cheaper and effective treatments and preventatives like the ivermectin, the hydroxychloroquine. I tried to go to the local drugstore here to get some ivermectin. They did not have any, had not had any for months, and if they did get it, it would cost me $700. This is a drug that you could get before this for less than $1. It's very effective by every measure. Every doctor that has used it, they've had patients who have not died. And the last thing I want to say is, if we don't hold Fauci accountable for this, because he funded this, that murderer should be put in jail.
He funded what?
The research of the enhancement of the COVID-19, and then further.
Well, he did not out of his own pocket, but he certainly was involved in dealing with the Chinese laboratory that should never have been allowed. So yes, a related issue. All right. What about these alternative treatment methods that we hear so much about? I have yet to hear of a definitive study that indicates that they are that effective. But then again, you are the one who's been doing the research, Paul Seegert. So go ahead.
Well, we do have effective therapeutics, and they have been kind of discouraged in our conversation about it because we didn't want to, and I think it goes back to that whole noble line topic. They didn't want the population to think they didn't need to get vaccinated, so we downplayed therapeutics.
Is downplay another word for lied about?
Yeah, misrepresented them. Yeah, there are certainly cases of that. Yeah, absolutely. And it's where all of these things, I think, are subject to, it's the effects of a corrupted economic pharma kind of model that we have. And you and I have talked about big pharma before.
Yes.
Pharmacy benefit managers and everything that goes on there. And we have, that's a very powerful player in our healthcare system, and they're doing. This has been an arms race essentially in the drug business.
All right, to Lance in Galloway, New Jersey. Hello.
Gracious, good evening. Thank you, Jimbo, for taking my call. Mr. Siegel, it's a pleasure to listen to somebody with some clarity, even if they are swamped with stupidity in regards of what the government's doing. 3 quick questions. The suppressing of the Barrington report by the 3 esteemed epidemiologists, that's number 1. Number 2, if the government, in its infinite way, tries to deliver all these tests and the people get the tests, 2 things. What's stopping somebody from getting the test and then trying to put it up on eBay to sell? And number 2, how are they going to prevent tampering with the tests to see if the tests actually read a positive rather than the unfortunate results of a false negative? All
right, let's let our guest respond to those. Go ahead, Paul. We'll start with, I guess, the suppression of this, what is it, Barrington report? Is that?
Yeah, there's a thing called the Great Barrington Declaration, and some of the brightest minds now in the world, many thousands of scientists and public health experts have signed on to this, and you had some of the best. The 3 that you're referencing were from Harvard, Stanford, and Oxford, I believe. And since then, many thousands have signed on to this Great Barrington Declaration, where they recommended that we approach this in a way, this whole COVID experience, that we would protect the vulnerable parts of the population and allow those that were not at higher risk to live more normally and achieve natural immunity in that portion of the population, while we vaccinated those that were at high risk, and that would get us through this experience most quickly, that children should go to school and so on. There's a lot to it, but I agree that has been intentionally suppressed and not out there. They're really, if it didn't agree with the messaging, it was suppressed, and that's a good example of that.
All right.
And the testing,
now, regarding testing, reselling, and testing tampering.
Yep. I think it is a good lead into some of the other things that I've been watching closely lately, and that's the approach now that we're taking to testing, even though we have this serious shortage. The solution that's being put forth is to say, hey, your insurance company now is going to pay for 8 tests a month for free, which we've talked about insurance before. That is not going to be free, and that is definitely not the most efficient way for us in our system to get.
My insurance is going to pay for unicorns for me free, but of course the trouble is I can't seem to find any unicorns.
Exactly. And then is there any incentive for these manufacturers of these tests, when they do get some of these, more of them approved, what are they going to do to the price of that test when the consumer is not going to whine and cry about the cost? They're not going to see it. The insurance company is going to pay some overpriced number. and that'll likely lead to hoarding. It'll be the next toilet paper potentially. When you can get 8 free ones, you might get them if you don't need them, because what if there's a shortage again?
Yeah.
So I think that is a real possibility.
Okay.
And the whole fake thing, that's another thing.
Have we had problems with tampering with these home tests?
Well, we haven't, frankly, had access to many. So I don't think we've had quality issues. We've had more of a turtle approach.
It's a quantity, not a quality issue, yeah. Okay.
Yeah.
Christine in Kendrick, Idaho, hello. Are you there, Christine?
Hello, Jim. Yes, sir. I took you off my dashboard so that I'd be not complicated. Okay, so here's my concern. We run a brewery and a restaurant in a small town, so we are supposedly the major super spreader, not big box stores or grocery stores. We get all that, or liquor stores or vape stores or marijuana stores. So we opened May 1st in Idaho against the governor's decree. And we've been open ever since. We've paid huge penalties, huge fines. We are in a town of 300 and some people. We are a destination place, so we do get, by the course of the end of the year, thousands of people come through. We never wear masks. We've never worn masks. We don't have red X's on the floors. We do not test our employees. We do not take temperatures of our customers. We do not sit chair back to chair back so many feet. We have not complied with any of it. However, I'm sure I had COVID in December of 2019. There is no proof that we're a super spreader. Although we paid like crazy, we've had the state police come down on us like a RICO warrant, kick my husband and I out, take our cameras. It's intense what we've gone through as a very tiny company in a very small town. So what we've chosen is faith over fear. I still have not had a vaccine, and I should want the public to know that I'm pushing 66 years old. When I had it in December of 2019, I was very sick.
Well, do you know if you had it? I mean, did you go to your doctor?
So here's how I know.
Well, the question, I'm curious. Did you go to your doctor? I mean, just because you get sick doesn't mean you had COVID. I'm just curious. I would tend to have gone to my doctor. I just wonder if you did.
I did go to the doctor. I went twice. They had no idea what was going on. I'm trying to.
They could not tell. You have a doctor who couldn't tell if you had COVID? Maybe you need a new doctor.
Not in 2019. It was December. It came out in 2020. So I'm telling you, I had low oxygen. I coughed. I was sick for 3 weeks. I was sick for 3 months with a cough.
All right.
So I've never been sick since. And I've hugged thousands of people, thousands, because they come.
Well, I hope they haven't been sick either. All right. I don't know that this directly relates to all that Paul was talking about, but before this break that we're overdue for comes up, any response to Christine, Paul?
Well, I would just say that when people ask me what to do, if I were high risk, I would do all the things that you didn't do if I were high risk. And so, I'm not an anti-vaxxer. I think each person can make their own decision on some of this stuff. We do know natural immunity is real, but you can show that you have it. You can get an antibody test and be sure, and then behave appropriately, and that would be my recommendation.
All right. Back with more in just a moment. Back to the Jim Bohannon Show with healthcare consultant Paul Seegert and with Bill in Irwin, Pennsylvania. Hello, Bill.
On a very sad note, and actually I can't even get it through my head right now. We buried my brother-in-law on Friday. He was 58 years old, didn't smoke, barely drank. He didn't have a beer now and then. Very good Christian man.
Well, we're sorry that we lost him. Does this relate to the subject at hand?
Yes, it relates to COVID. He went in, he was diagnosed in a hospital here in Western Pennsylvania as COVID pneumonia. Okay, but here's the problem, Jimbo. The man is gone. He spent 40-some days on a ventilator. He had died. They did not do anything in this hospital to except for put him on a ventilator and watch him every day.
Well, I'm sure that they did more than just put him on a ventilator and watch him every day. I mean, I would assume they were doing all they could.
You're not hearing me. You're not hearing me.
Well, I guess you're saying that the hospital engaged in egregious malpractice and killed your brother-in-law is what it sounds like. Really?
No, I am not. I am not.
Well, then
saying
what?
that.
Then what did they put him on a ventilator and watched him? I'm sure they must have done more than that. What else did they do?
No, they did not. No, they did not. They had tolls. There are tolls out there. There. You know what? Just because they're cheap, he could have been saved. They were not going to give it to him.
Did your doctors agree with this assessment? Did your brother-in-law's doctors agree that there was extreme malpractice on the part of the hospital?
Jimbo.
I'm asking you a simple question, Bill. How did your doctors feel about this? Are they prepared to testify in your lawsuit against the hospital? I'm just curious.
You don't have a lawsuit. We don't have my brother.
Well, whatever, Bill. You're obviously very distraught. So, any comments, Paul? Feel free.
Well, I'm gonna give that hospital the benefit of the doubt that they did everything that they could.
Mm-hmm.
And
the
they
hospitals don't particularly like
follow.
major lawsuits. I would tend to agree. All right, Michael in Virginia Beach, Virginia. Good evening. Or put another way, Michael in Virginia Beach, Virginia.
Hi. Can you hear me now?
Yes, I can hear you. Go ahead.
Oh, okay. It's not my topic, but I will just quickly say to the last caller, Dr. Fauci's longtime colleague at NIH, one of the world's greatest virologists, says the sure way to kill someone with a COVID infection is to put them on a ventilator. So if you want to get Dr. Judy Michaelwitz, Dr. Judy Michaelwitz on the show, you'll find out.
So automatically putting somebody on a ventilator kills them? I'm trying to understand this.
She's a lot smarter than...
Well, I don't care. She may well be, but first we've got to determine exactly what it is she is saying. Is she saying, as it sounds like you're saying, that being put on a ventilator is an automatic death sentence? I'm sure some people need to be on a ventilator.
That is exactly what she says. Get her on the show.
That being put on a ventilator is automatically a death sentence. All right, thank you. Paul, your thoughts about that? I seriously doubt that being put on a ventilator is an automatic death sentence, or that the doctor in question has ever said such a thing.
Well, they've saved lots of lives, and I think the way that we
yes, they have
did that warp speed and got those manufactured and became a supplier to the world, frankly, of those is what we need to do around our lack of testing today.
All right, more to come. Back in a moment. Welcome back to the Jim Bohannon Show at 1-866-50-JIMBO, 1-866-505-4626. Healthcare consultant Paul Seegert, also a managing partner of PCS Advisors, is our guest. If you're on the line, we will get to your call because Mr. Seegert has graciously agreed to extend into the next hour. Let's go to Dexter in Camdenton, Missouri. Hello.
Hey, how are you?
Fine, thank you.
Good. Hey, listen, just up the street from where you grew up. Anyhow, the lady that called in from Idaho,
Yeah.
I got to agree with her. A friend of mine and I, back in December of 2019, had the flu. You know, we lost our sense of smell. Got it back. Everything's fine. I've never had a flu shot. Won't get the vaccine, and I'm glad I live down here because they kind of support that. But the thing is that
what's the COVID rate in Camden County? I'm just curious.
They had, well, I guess I don't know that exactly, but
you don't have to know it exactly. I know that in nearby Laclede County it's extremely high, but anyway.
Well, we were maybe 400 or something like that, maybe 700.
Well,
and
again,
the county is 45,000 people, and there was a couple deaths out of it, but
a couple of deaths. Okay, well, that's a pretty good. That must be a pretty healthy county if you had a couple of deaths. All right. Any comments from our guest, Mr. Seegert, for Dexter?
The 7-day average looks like it's 1,852 COVID cases in that county.
1,800. Well,
yeah.
I guess that's more than
per day.
Per day. Okay. Well, all right.
Yeah.
Greg in Ventura, California. Good evening.
Jim, if this ivermectin is supposed to work so good, why can't people get it?
Well, okay. Paul?
Well, whenever there's a disease that comes along, they'll go to existing therapeutics to see if they might be effective for this whatever the new disease is or the new thing that we're dealing with. And that can often lead to a shortage because it's being produced in a supply for what it was intended for prior. So there's a shortage as a result of that. And then it also goes back to the fact that we've had a very very focused approach, get everyone vaccinated, and we've downplayed all of the other therapeutics that are out there, and really anything that might discourage the population from getting vaccinated.
Again, that's really dumb. You can encourage vaccinations and also offer therapeutics.
Totally.
Walking and chewing gum at the same time. David in Chicago. Hello, David.
Hi. I was wondering if I could bring up an issue that was going around for a little while about Fauci and the pharmaceuticals preventing information from being made available to the public for another 50 or 60 years, so there would be no transparency. I think it had to do with how they formulated the vaccines.
The vaccines, of course, we know how they were formulated, and we also know that they're more effective than any vaccines in history. But I'll defer to Mr. Seegert. I'm not aware of any suppression of information for decades in the future. Is that another one I've missed somewhere? Paul?
No, that's not something that isn't something that I'm aware of either. I know there's conversation around should these drug companies, because of the public-private partnership, should they have ownership essentially of these vaccines and get the same patent protection that they would get for other drugs? And so far they are getting that, but there has been talk of them not getting that. And then there's a company in Texas that just is right now in the final stages of coming up with a vaccine, and it's their intention to make it open source so that other kind of disadvantaged countries or developing countries could manufacture it themselves.
All right, more to come. Stay on the line. We'll speak off air. Paul Seegert, healthcare consultant, managing partner of PCS Advisors, and more calls to come after the break on the top of the hour, so stay with us. And 1-866-50-JIMBO is our number. I'm Jim Bohannon, and this is Westwood One. Talking about some of the confusing, conflicting, and contradictory recommendations from the Centers for Disease Control, and doing so with Paul Seegert. He is a managing partner at the financial advising firm PCS and also a healthcare consultant. Here is Pat in Sedona, Arizona. Good evening, Pat.
Good morning. Good evening, Jim. Just wanted to... Oh, boy. Oh, good. Can you hear me, Jim?
Yes, you're on the radio, Pat. Go ahead. What's on your mind?
I'm sorry. My phone kind of cut out on me. This is my question. I have one for your esteemed person you have here. I forgot his name. I'm sorry, sir.
His name is Paul, but go ahead.
Paul. Okay, sir, Paul. Have you found, since it sounds like you've been at the beginning of all this and you know of law and knowledge, it seems that we were extreme rush and fortitude under Trump. And when Biden came in, did things slow down, or am I misunderstanding that? It seems like the two different administrations are handling the same disease differently. And I'd like to comment on that.
All right. I don't know what things might cover. Obviously, the development of the vaccines occurred strictly under Trump. Paul, go ahead.
Well, I would say that, yes, with that change of administration, we did see, it may not be attributed to the administration, but certainly along that same timeline, we saw a very different approach to testing, and we're paying the price for that now, and I think we've paid a price through the whole process because of a lack of testing. Had we had a robust supply of testing early, then it would have been easier for our public health experts to find where are the outbreaks, who has COVID, who doesn't. It's something that simple. And so we didn't apply the same urgency. We didn't do the same. The Operation Warp Speed was successful because it was a public-private partnership, and we cleared red tape out of the way. And we did these vaccines went through all the same steps. They did it more quickly. And we're not taking that approach to testing. It's very slow. In fact, I was just reading.
But I mean, you indicated other countries are doing it pretty fast, right? Did you mention
Very
Germany
fast.
in that regard?
Absolutely.
So it's not as though you
Within a week.
not as though you can't do it more quickly. It's just that we've chosen not to for some reason.
Exactly right. And we've again, some of that noble lying plays into it, where some of the comments from some of the folks leading our response have said, well, shoot, if they had these rapid tests, they might not think they need to wear masks anymore. Some of this stuff. It's the walking and chewing gum comment that you made earlier.
Yeah. All right. Paul in Zanesville, Ohio. Good evening, Paul.
Good evening, Jimbo, and Mr. Stortz?
Paul Seegert. Okay, go ahead.
Seegert, yeah. Hey, yeah, I got my vaccination Johnson & Johnson back in 2020 in March, and right now I've got a pretty nasty head cold. Okay, but it's just a head cold. My wife's like, "Oh, you better rush up there, and get tested." Well, no, I've gotten head colds for years. But my question to you is, how many cases do you think weren't just COVID? Cases, maybe it was by something combined with that, because that man that called
something combined with. I'm not sure what you mean by something combined with. I mean.
Maybe maybe high blood pressure, cancer, something like that, diabetes.
Well, I mean, things like high blood pressure and cancer have their own symptoms that generally don't coincide with those of COVID.
How many of the folks that had severe illness have comorbidities?
Oh, comorbidities. I grant you that I don't know that this example was true, but there are people who were supposedly diagnosed with COVID, let's say, and they died of something else. Maybe they walked in front of a bus. Obviously, you wouldn't count that as a COVID death, but I mean, apparently there were bonuses underway at some hospitals for treating COVID as opposed to other things. So have we ever nailed down the extent to which there was a fudge factor at work here, Paul Seegert?
Well, they are coming up with some of those numbers, and what we're seeing is that there is a significant number of people that died with COVID versus of COVID. I think they're going to become more and more transparent in the near future.
Well, now would be a good time to start.
That's for sure. Yeah. It's a very real factor. And then the other issue is that fact that we do know that those folks with comorbidities are at the highest risk. And there are peer countries of ours that have approached it differently, where they focused in on protecting those who are at high risk and maintained a little bit more of a normal pattern of life for those that were not, and achieved as good or better results.
Yeah, obviously the comorbidities have a lot to do with the fatalities in this regard. Lionel in Raleigh, North Carolina. Good evening.
Jimbo, anybody
Yes.
with the vaccine is an idiot.
I think not, Lionel.
You know,
What, are you talking any vaccine or just this vaccine? I'm just trying to find out just how far off the edge you are.
it don't hurt. It don't hurt nothing to get the vaccine. It can't even hurt my health. The idiot.
Whatever. Good. Nice to hear, Lionel. Thank you very much. I'm glad they give you telephone privileges at the home. Steve in Dallas, good evening.
Well, yes, sir. Thanks for taking my call. I'd
Sure.
like to ask your guest, as a healthcare consultant, as you can hear from the calls tonight, people are frustrated and skeptical.
Yes, they are
and
definitely
confused. How
frustrated.
long-
That's true.
How long do you think it'll take the medical industry and the healthcare profession to recover its credibility in the face of the actual results that people see every day?
An
in their workplace,
interesting question.
in their homes?
I don't suppose there's a definitive answer to that, but let's just say that it's taken a hit. Wouldn't you agree, Paul?
It's taken a hit, and I think our leadership at a national level has taken a serious hit. That will take some time, and we're just going to have to see how much. But the companies of today that were part of Operation Warp Speed that helped solve and do some amazing things have been, on the other side, on the outs, so to speak, for misbehaviors in the past and been forgiven. And I think we'll get through this. And I think we're getting toward I think we're in the fourth quarter of this experience. I think that's why we're starting to get messaging like we are.
Certainly can hope that is the case. Jay listens in western Nebraska. Hello, Jay.
Hi, guys. Thanks for taking my call. I appreciate the time to do that.
Mm-hmm.
So my question is that I'm noticing that there's a lot of confusing messaging coming out of the government, and there's really not a way to engage these appointed officials to have them at least address these other things that we bring up. And I hate to suggest that maybe we fight government with more government, but I'm wondering if almost we need a ombudsman or an inspector general who can take some of these concerns that people are bringing up to, I guess, the government officials and say, hey, you need to address this. This is an actual concern.
Well, that might have merit to it, Paul Seegert.
Well, we have those folks. I think they exist. I just think we've got such a
What you mean
conversation.
that recommendation is already in existence?
Yeah, we have.
Because I certainly wouldn't know how to reach such an ombudsman.
Well, that's for sure, and we can reach out to our representatives, but I don't know how successful that will be. But we can do it. We can do that.
Yeah.
But yeah, it's a tough spot that we're in.
Yeah. Jim in Dover, Delaware. Good evening.
Yes, I don't know where to start, but I called about the ventilator situation. Initially, they looked at it as the ARDS picture. I'm a retired healthcare worker. ARDS standing for Adult Respiratory Distress Syndrome, where the person has stiff lungs and they have to promote oxygenation using something called PEEP, positive end expiratory pressure. They found out it did more harm than good. It did nothing but harm. And a matter of fact, so they had to go to a different method. These doctors from the front lines figured this out a long time ago, so I'm surprised that you...
So what, ventilators have no use whatsoever medically in your view? Is that what you're saying?
I worked as a therapist, of course.
Well, I'm just asking you a question. Are you suggesting that ventilators have no medical purpose whatsoever? That's what I'm asking.
And we're talking about COVID. And COVID.
Well, I know we are, and I'm still asking the question. Are you suggesting that ventilators have no medical purpose whatsoever? I don't know how else to put it.
Well, I'm trying to tell you. I'm saying with respect to COVID, no, they don't. And in fact, they're using this other drug that Fauci sponsored, remdesivir, euphemistically called "Remdesivir" by nurses around the country, because that plus the ventilators, the patients end up with respiratory or kidney failure, and they die. There's always a bad outcome. And this was
let's let our guest respond to that. Are ventilators that bad, Paul Seegert? I was told that they kept many people alive.
They have saved lives, but there are, when you look at the results and the statistics, when a person is severely ill enough to go on a ventilator, the outcomes are not great. They vary.
Yeah, I mean, you wouldn't go on a ventilator in the first place unless you were pretty seriously ill, right?
Exactly. Yeah, exactly. And it's a wide range, but it's not good. It's not good news when you go on a ventilator.
No, but again, you wouldn't be going on it if you didn't have serious problems to begin with. All right. More calls to come here with our guest Paul Seegert, 1-866-50-JIMBO, and back in a moment. Welcome back to the Jim Bohannon Show, 1-866-50-JIMBO, another segment with Paul Seegert, healthcare consultant, as we talk about the confusing messages that have been coming from the CDC. Here's Matthew in Janesville, Wisconsin. Good evening.
Hi, guys. Thanks for having me.
Sure.
Yeah, I would like to discuss, the huge amounts of freedom of speech and censoring. Everybody in my family got the vaccine and still got COVID. But what's funny is in 2020, I left the country and I went to Lebanon. And when I got there, I seen all the college-age students having COVID parties, getting COVID on purpose, then running down to the Red Cross and getting given blood and getting $1,000 because they had the antibodies to COVID. And they were taking the fear away from the COVID, and we're here. We really pushed the fear.
Well, you can get pretty sick from COVID, and I don't think that's the best way to develop immunity, Paul Seegert. But you tell me.
Well, that's an interesting one. We used to do that kind of stuff here, but we haven't done it with COVID. That's for sure. And not everyone's at the same risk. We've talked about that. If you have comorbidities, don't go to a COVID party, would be my thoughts.
I would certainly think so. Let's see. Well, Bill in Rochester was next, but Bill is gone. So Jason in North Myrtle Beach, South Carolina. Good evening.
Good evening. Thanks for taking my call. I just want to say on the note of, those who are unvaccinated, I'm 46 years old. I'm not vaccinated. I had the coronavirus September 11th through the 25th. I have official paperwork. I'm an Air Force veteran. I survived it, and I was tired, fatigued, 7-8 days. 9th, 10th day turned around, and I didn't have to quarantine anymore. But my point is, I've known 500 people who are all the same that are unvaccinated. In the Myrtle Beach area, we get people from everywhere, all walks of life, New England, Ohio, wherever. And all these people tell me they were unvaccinated and survived the virus. I mean, I'm just saying on a positive spin, I know a lot of people have died from it, and that's sad. But, I know so many people daily after daily that are all unvaccinated who've gotten through this.
Well, I don't know that anecdotal evidence is necessarily definitive in that regard, but I'm glad you know people who are doing fine. Paul Seegert?
Well, I mean, we know there are more than 90 studies that do confirm that natural immunity is a real thing. And
it is real, without question, yes.
And there's
getting sick to obtain it, deliberately getting sick to obtain it doesn't strike me as a great idea, but...
No, I would agree with that. We had COVID that went through our entire office. And what I would encourage people to do is if you're relying on natural immunity, get tested. It's not hard. We could do that more easily than we can test you for COVID today. So get antibody tested. We had our office tested. Everybody had antibodies. So then those that didn't want to get vaccinated knew they had antibodies. So we all felt a little better about that than some of the anecdotal stories you hear from folks who say, well, I kind of felt really bad, so I probably had it. That's a little bit more flying fast and loose in my view.
Yeah, that's. I would rather know myself. All right, to Jimmy, who is in South Georgia. Hello, Jimmy.
Hello, Jim.
Hi. You're on the radio, Jimmy. What's on your mind?
I was going to ask Paul. He's done a lot of research on this. Do you see an end to this COVID, Paul Seegert?
Do we see what?
We're going to live with it. An end.
Yeah, I don't know that we're going to see this go away. Let's not forget what we call the flu has not always been around. What we call the flu is simply the 1918 pandemic that has never gone away, but it wasn't here before 1918, at least not that we know of. And there are those who believe that it'll never, the COVID will never go away. It'll just be something that we deal with every year. I mean, people die of the flu every year, but we don't get crazy panicky about it because we're used to it. We accept the fact, okay, it's flu season, some people are going to die. Just like we accept the fact that, okay, you drive a car, 30-some thousand people a year die in car wrecks. I mean, part of it, I guess, is attitude, but I don't know anybody who is suggesting that all of a sudden that COVID will just disappear. Your thoughts?
Absolutely not. Yeah, it's going to be endemic. It already is endemic, and I think the science said that from early on. We weren't going to eliminate COVID. And I think the original messaging was good messaging. The original messaging was slow the spread. It wasn't stop COVID, which was really just a goal that we weren't going to be able to hit.
Yeah. Again, it just it strikes me that frequently we have been talking about things that were impossible. Skip in Burlington, Vermont now. Hello, Skip.
My son-in-law contracted COVID just yesterday, and he brought it home to his family. And I can't stress enough, get vaccinated. Get vaccinated, wash your hands, and wear your mask. That's definitely. You have to do that. You have to wear, and then, what is it, N95 mask?
Well, the M95 masks, I think, have been brought up a great deal, yeah.
Yeah. So,
a quick question about, thank you, Skip, I'm sorry about your family. About 30 seconds, Paul, are the M95s available, and are they worth it, and how much do they cost?
They are, and they're the ones that we know for sure work, and they're accessible. So we have plenty of supply of the mask. It's the tests that are an issue. And it's really just a couple of bucks, and it's worth the investment.
Fair enough. All right. Well, we thank you certainly very much for providing us with your expertise on the subject tonight. Paul Seegert, managing partner of PCS Advisors and healthcare consultant. We'll continue with more on the Jim Bohannon Show coming up in just a moment.